All right, we're going to set a patient up on the table for a side posture adjustment, and today we're going to demonstrate the side posture positioning for a push move. Now the first thing we're going to employ is the pillow trick. I'm going to do this setup with the patient's left side up, so the pillow needs to be on my left side. That'll always make sure that the patient's left side is up on the table, and I'm going to make sure that I use a face shield or a piece of paper. I'm going to ask the patient to go ahead and lay down on the table, head up here and feet down there. And I want to make sure I put them in a position where their foot can be just off the end of the table. I like it when the malleolus is off the table, not too far, not too close in. So this is pretty perfect. Here's step number one, straighten the bottom leg. Step number two is to bend the top leg. Here comes step number three, body has to roll down to the end of the table. I'm going to ask the patient to come forward, please. Come on. I make sure that my body is at the side of the table here so the patient can't come too far forward. When I'm asking him to come forward, I'm going to help by supporting the patient's knee. So when I get him all the way to the front part of the table, I'm going to do the next three steps, which is up with the foot, down with the knee. I'm going to bring it down and straddle it between my knees, and then we're going to go in with the shin. Pressing his shin towards his belly button will bring his spine into flexion. I'm going to open that so that we can see. I'm going to go in with the shin and untuck this glute. I'm going to bring it a little bit back and a little bit down so that I lengthen the bottom side and untuck that glute tissue. Now I'm going to ask the patient to hold on to my arm, the other one, and I'm going to pull the shoulder down so that I get the posterior third of the deltoid onto the table. And I'm going to pick one of two arm positions, which we'll talk about in class. So I'm going to hold up those arms. I'm going to ask the patient to always face straight ahead. Now in this position, I'm going to go find a segmental contact point that I'm going to hold on to. And today I'm just going to grab a hold of the inferior aspect of the PSIS. I'm going to take a really good tissue pull, and I'm going to have my whole hand nice and flat on that patient. I'm going to hold the stabilizer. Either the elbows are distracting up, or I can open up the patient's arms and distract up the shoulder towards the ear. So I'm going to pull that down because I like the elbows. They give me a little more leverage. I'm going to hold that up, hold the rib cage up, take my contact, hold that up tight. In this position, I have full control of the patient and I'm at tension. I can now let go of the knee. So I'm not going to use that leg anymore, and I can move my body all around wherever I need it. I'm going to roll the patient towards me so that I can get in a line of drive. Now, right now, my elbow is in a position for a PI ilium. So if I'm comfortable with this tension in this line of drive, I can now set in my legs. So this is what I'm going to do. I'm going to take my front foot here. I'm going to place it underneath the weight of my body. Then I'm going to take my back foot and I'm going to make sure that it's parallel to the patient's thigh. So in this case, I have to roll them to me just a little bit more so that we can be parallel with each other. The action of the doctor is to use the weight of their body to drop in towards the patient. So the action of the body drop is bending through the front knee and collapsing onto the patient's thigh while the contact hand pushes. Okay, I'm going to have you lay on your side, put your head up here. We're going to scoot down the table just a little bit and bring the pillow with you. And straighten the bottom leg, bend the top leg, come to the front of the table, up with the foot, down with the knee, in with the shin, down with the shoulder. Find your stabilizer, find your contact, hold both of those up tight. Let go of the leg, roll the patient to you for a line of drive. Set your front foot underneath you with the toe pointed up the table. Back leg, no weight on it, onto that thigh. Body drop and push.